Good morning, everyone, and thank you for joining us today. Really appreciate you giving us some of your time. We understand that this period right before AEP is just as crazy it is for you as it is for us, so thank you very much for being with us here on this beautiful Friday. My name is Chris Orth. I am a regional sales manager here at Anthem Blue Cross and Blue Shield of Wisconsin. Today we are going to get into what our 2022 product will look like on the Medicare side, specifically going to be focusing on the Advantage and a little bit on the PDP. And really excited to share with you some of the really fantastic new benefits that we have, a little bit of an expansion. And as the title of this meeting that you signed up for, this is going to be our condensed version, meaning that we are going to get really hard and heavy into these benefits. We're going to take away some of the traditional rollout slides. We're going to really dive deep and get you the information that you need, and hopefully get you out of here in an hour. So once again, thank you very much for joining us. Really excited to present what we have to show to you here today. As I mentioned, my name is Chris Orth, and I am a regional sales manager in the state. If you look at that beautiful color-coded map on the right there, we have 4 regional sales managers in the state. What this means for you is that no matter where you live in the state of Wisconsin or where you're selling, you have someone dedicated specifically to you, helping you with anything from marketing to product knowledge to process knowledge. We are here to make sure that you are comfortable selling Anthem now and moving forward. In addition to that, we have 2 fantastic agent service reps, James Peck and Patrick Smith. James is going to operate on the southern part of the state. So if Steve Gajardo or Rick Kroll are your regional sales managers, James Peck is going to be your ASR. If you are in the northern half of the state, Ruby Nunez, who does the northeastern part, or myself, which does the northwestern central part of the state, Patrick Smith will be your ASR in that case. Above all of us is Liz Johnson. Many of you may know Liz. She's been working in the state, and at one time she was the only agent-specific employee working with external agents like yourself in the state of Wisconsin. So we have expanded quite a bit in the state in terms of providing resources such as myself to help you out. So please utilize us. Our numbers are posted here. I will have this slide up at the end of the presentation if you didn't get it. Just wanted to note that no matter where you are, you have someone here to help you. Now, when it comes to Anthem, we are a national carrier. We have plans offered in 23 states, and we have just added Puerto Rico as one of the areas in which we're selling. We have a very big amount of dual SNP growth. I'm going to talk a little bit about what our dual SNP plan looks like for next year. We have some really exciting updates on that. And we're number 2 in Medicaid plans nationwide. We do offer Medicare supplement plans in 16 of the 23 states in Puerto Rico that we currently have an offering. Wisconsin is one of those states, and we have a very competitive supplement. Over 2.5 million Medicare members for Anthem in all of our states. We've outpaced the market in our service area. Now, this is specifically true in Wisconsin. When you're looking in Wisconsin, what you'll see for the story for Anthem is a story of growth. We were top 2 in the state in terms of growth last year, and we're focused even more on it next year. We're hoping to expand our footprint, get more members on board, and with growth becomes potential for business for you as an agent, right? We see ourselves as a very big player in some spaces where we might not be right now this year, moving forward. So a really great opportunity for you to partner with a national known name, Anthem, a great name in Blue Cross and Blue Shield, and a really great growth opportunity. We have about 10% of the market share across our Medicare Advantage service areas. It's about 1.6 million members, and about 900,000 members of the Medicare supplement share. So that's about 15%. We are very much, as you can see, this is not something new to us as Anthem. We are in the Medicare market to stay, and we're here to grow in the state of Wisconsin specifically. In Wisconsin, we have every kind of plan for your member that you can imagine when it comes to Medicare products. So, as I mentioned before, focus primarily on the Advantage and the dual SNP plans. Today, a little bit of the prescription drug plans as well. This is a 2022 benefit informational meeting, so that's why we're going to be focusing on there. As I mentioned, we will have one slide on the supplements, not going to focus on that primarily today, but we are very, very competitive in the supplement space. And then Anthem Extras, if you don't know what that is, it's essentially a product that allows you to add additional benefits to a supplement plan, things like dental and vision and silver sneakers. The nice thing about Anthem Extras is not only can it be added to a Medicare supplement plan with Anthem, it can also be added to another carrier supplement plan. Not every agent I've talked to knows that. It's a really great thing to have in your back pocket because, as we know, a lot of supplements out there don't really have the add-ons for dental and vision like a Medicare Advantage plan does. So this is a really great opportunity to get some additional coverage for your member that they may be needing. So let's get right into it. What you're looking at is our Medicare Advantage footprint for 2022. Now, a lot of these counties in blue, if you're currently selling with us, are going to be very familiar to you. But we are, if you can see that little striped county in the middle of the state, we are expanding into Wood County. So when you look at Wood and all those counties in blue, every single one of those counties moving forward will have an HMO product in it, a PPO product in it, and a dual SNP product in it. That's one of the major things that we do offer here at Anthem is we offer a dual SNP plan in every county where we have a Medicare Advantage product. A huge thing which I'm going to talk about in more detail for you here today is we are expanding our footprint of the $0 local PPO. Now, some of you may be in an area where our local PPO is currently offered at $0. However, if you're selling across the state, this is going to make things a lot easier for you because this is really going to be our leading PPO moving forward. We're reducing our RX home delivery copay for tiers 1 and 2 to $0. That you're going to be seeing that on all these slides, a big deal. And we're going to be using Ingenio RX for our service for that. We're adding a lot of comprehensive dental, and I will go into that in more detail as well. MAP beneficiaries. I'm going to talk about that on the DSNP side. Major upgrade for us here in the state. One of the areas where currently we may be losing some membership, that's going to be a big win for us and for you and for your members. We have a market-leading DSNP plan. Many of you may know us as a DSNP company. We have a lot of membership on our DSNP plan. We're tweaking that so all of our RX on that DSNP plan is going to be $0. We're enhancing, has some really fantastic enhancements on our Essential Extra package, and we're giving that Essential Extra package a boost and putting it on our $0 LPPO. Really exciting stuff. Have a brand new MA only plan with a Part B premium reduction. Really excited to talk about this with all of you. This was a big hit for us when we did our in-person rollouts this year, so really excited to show this to you. We think this is going to be a big win for us in the state. And then finally, one point that is really important to note. Rural referrals are not required on our HMO or PPO plans. Now, this is not a change for us. This is how it is right now. What you may have seen in the past is some language saying referrals are not required, but are recommended. That caused a little bit of confusion in the market, maybe either with agents or with our members. That language you will not see moving forward. So referrals, when it comes to Anthem, we're not requiring those, all right? Important to note. So let's get right into it. And the thing I want to share with you here first is you see on this slide it says everyday extras. In Wisconsin, these are known as essential extras. Now this is a major benefit of our plans. And before I get into talking about these a little bit more specifically, I want to talk to you about what this is and how this can really benefit your members' experience with us here at Anthem. Essential Extra, I like to call it a pick your own benefit add-on, okay? So for plans that have this available, which is going to be our HMO, our DSNP, and our $0 PPO in Wisconsin, Your member has the option of seeing these different add-on essential extras and choosing the one that's most important to them. Rather than us picking and choosing for your member, this gives your member the opportunity to see what's most important to them and customize their plan to fit their needs, okay? Some of these essential extras, as you'll note, will require prior approval, okay? What that means is when your member chooses this essential extra, they will get some information from us, including something for their doctor to sign, verifying that they have something that will qualify them to get that specific essential extra, okay? So it's important when signing someone up for one of those services that they know that they will be getting something in the mail from us that does need to be filled out by their doctor before they can access this benefit. Another really great feature of essential extras is that if your member chooses something and they don't use it, they can make a one-time change throughout the year, all right? And now that can be done a couple of different ways. We do have a form for them to change, or they can simply call our customer service team and they will get them set up, okay? So what that means in terms of practicality for you as an agent, if you sign someone up on our plan for this year, maybe they choose the transportation benefit, and you meet with them next October to talk about their plans for the next year, and they say, you know what, Mr. Agent or Mrs. Agent, I really did not use that transportation benefit at all. Well, what you can do is you can say, well, you know, is there something else that you could use in the next 2 months before your plan expires or goes over to the next year? If there is, let's get you switched and let's have you use that benefit, you know, before the plan year ends up, okay? So you can switch one time per year as long as the benefit has not been used. Now let's get into the details here of what we have available. Now, if you are currently working with our product and you see the different available essential extras that are on the screen here, you may notice that a few of them are not on the screen, right? One of the bigger ones that you'll see is not on here is going to be the service dog support, ADA service dog support. Now, that plan will actually be embedded on 2021 products that have it available as an option right now. So what does that mean? If your member is currently on one of our HMO plans or DSNP plans, that will be an embedded benefit that they don't need to choose for next year, all right? So they can essentially get that and then choose another one, okay? I'm gonna go through these kind of in order from top to bottom. So the first one that you're gonna see here is assistive devices. That's $500 towards things like, think of it like a wheelchair ramp or outfitting a shower or bathroom to be more handy capable, right? Things like that around the house that could help a member towards living a little bit better life if they have certain needs for that. There's no prior approval necessary for them to use that benefit. They get $500. A health and fitness tracker, that's going to be a Fitbit that we will give your member along with a membership to Fitbit, okay? Now that's a once every 2 year item, so they can't order another one next year, all right? Once every other year. Healthy meals, so 2 meals for 90 days or 180 meals per year. This is a prior approval, so there will be certain things that your member will need to qualify for. Things like BMI will be on here, maybe diabetes, things like that, that would qualify them for that benefit. Personal home healthcare, all right? So if your member has a couple of activities of daily living that they need assistance with, they can select this benefit and they'll get 124 hours of someone coming into the home and helping them with some of those activities of daily living. Pest control. If your member is in a situation and let's say they have a situation with mice and it's actually causing an issue with a health condition or actually causing a health condition in general, they can select this benefit and we'll come in quarterly or a one-time eradication service and take care of that with them. Transportation, 60 one-way trips for this benefit. That's a 60-mile radius for that one-way trip, and they can use that in addition to if their plan has transportation built in, okay? Flex card, this is gonna be a big one and I have a slide on it coming up. $500 towards dental, vision, and hearing. There's no network for this. Just has to be an authorized dentist, audiologist, or optometrist, okay? $50 a month on the grocery benefit through our Healthy Groceries one. Now, this does require prior approval for the HMO plan only, okay? What that means is that if they select this benefit, they need to have certain conditions that qualify as that. That's not an us thing. That's actually a CMS requirement that if this is an additional benefit that someone can choose, that they need a reason for it. But there's a lot of conditions that would work for a member. We actually did some research on our current HMO members, and 81% of them would have a condition that would qualify them for this grocery card. Now, that could be anything from high cholesterol, right, diabetes. There's a ton of conditions in there. So the odds are, like I said, 81% is a big amount. The odds are that a member would probably qualify for this. And then finally, Papa Pal, which is our in-home support benefit, 60 hours of social isolation support, someone coming in, hanging out with a member, really great benefit that's available to be added for the HMO and DSNP plans. Okay, so let's get into some of these new benefits specifically because they are really great things and we think they're going to be awesome in the market for us. So first off, our Healthy Grocery Card. Like I said, HMO plan, it can be added. Our DSNP plan, it's embedded, okay? And the nice thing about the DSNP plan is they do not need to qualify to use those services, okay? They're going to get this $50 a month grocery card no matter what, no matter if they qualify it or not. HMO, they need to qualify. It needs to be used as essential extra. How does it work? $50 a month does not roll over from month to month. They will get a card that can be used at specific grocers, and I have that list coming up here. A wide range of grocery products can be used. Fresh fruits, frozen vegetables, the deli, meats, fish, dairy. What it can't be used for, right? Alcohol, tobacco products, no Busch Light, no Marlboro Reds. Non-food stuff like cleaning supplies, things like that, it will not be used for. There's no pre-cert, like I said, on the DSNP. It's really important to note that there will be an online tool available for our members that they can find local retailers and check the balance of their card. Like I said, it does not roll over. So what would happen is if they only use $5 of it, they'd have $45 for that month left. It wouldn't add on. It would just be another $50 next month. Okay. There are some limitations in terms of shipping and delivery on them. So that's important to note. We will have information on that when they get the benefit. Okay. So that's important to note as well. Where this can be used, when we're talking about Wisconsin, the big names are on there, okay? Walmart, Cub, Woodman's, Piggly Wiggly, Festival is on there. Hy-Vee is on there if you're in certain parts of the state. CVS, not the CVS's inside of a Target store, but standalone CVS's they can use this at. If your member is traveling and they have this, we're going to be able to use this in a lot of different areas, right? Southeast grocers such as Winn-Dixie's on there. Lunds and Byerly's, if they have family members in Minnesota, there's Lunds and Byerly's over there they can use it for. Albertsons, a lot of grocers available through this, okay? Just some more examples of what can be used and what can. Now, a big thing that was actually added since we've done our rollouts is you can actually use this grocery card at the deli, the bakery, the salad bar, and the hot bar, okay? So I like to use the example of Festival because I live in the Green Bay area. They have some really awesome sushi that they do there. You can use this for sushi. They have some really good hot ham sandwiches that they do. You can use it for that. In addition to your regular grocery items, right? Meat, seafood, produce, dairy, frozen foods are available. Protein bars and protein shakes are on there as well. What it can't be used, health, flowers, health and beauty care. The in-store coffee shop purchases cannot be used there, okay? OTC items, non-edible groceries. So like I said, this is going to be a really big benefit for our DSNP members. They don't need to select anything. They'll get this card no matter what. HMO members, if this is something that's important, maybe you get 2 HMO members that are in the same household. Now they get $100 towards their groceries a month. Big deal. Next one, this is brand new for this year as well, Flex Account. This is something that is not is available to be added on our $0 PPO plan or our HMO or DSNP plans. No pre-cert required on this. What is this? It's a master debit card that can be used at any dentist, optometrist, or audiologist. What that means is your member doesn't need to worry about a network with this, right? As long as they're going to an official dentist, optometrist, or audiologist, they're going to have $500 that they can spend. Now, they can also use it in addition to the dental and vision benefits that I'm going to talk about on specific plans, all right? Full amount is available right away. If they enroll in October of next year and only have obviously 2 years before that plan year is over, they'll still get that $500. So $500 right away. They can use it up right away, and it's a really, really great benefit. Now, what's important about it is that if you're in a situation where a member's at a Walmart, let's say they are purchasing non-prescription eyeglasses, okay? And let's say they take those eyeglasses and they check out at the regular Walmart checkout. That card will decline the purchase. However, if they were to do the same thing and go to the vision center inside of the Walmart, it would be accepted. Why that is that different providers or vendors have codes that are specific to what their services are. Okay, so dentists, optometrists, and audiologists will have a code within their credit card system that puts them in a merchant category for those. So this card will be accepted for anything provided at one of those 3 merchant codes, okay? But it won't work at a regular checkout. So it's important to note, let your member know. Pop-A-Pal, I already kind of talked about this, pretty self-explanatory. Members having issues, just want to have someone in touch with them, someone to talk to, someone to do a couple of light chores, or even someone just to drive them around. They can select this. They'll get up to 60 hours per year in companionship and assistance. What will happen is once this member, this is selected, the member will get information on how to get in touch with Pop-A-Pal. Pop-A-Pal will then find someone who's been background checked in their area, set up an initial visit, let the member see how they like interacting with that person, and if they do, they can schedule subsequent visits up to 60 hours through a benefit. If for some reason it doesn't click there, they can find someone else in their area as well. Okay? So that's important to know. Something that's available to our members at no additional cost, they don't need to select it, and this is important to note, is our Medicare Community Resource Support. Now, what this is essentially a case manager that will give support to your member or get them in touch with local support in their community. So if you're having a member who's having a tough time with some basic needs stuff like clothing, food, or shelter, we can have they can call customer service, and we will connect them with someone who can find community-based support programs for that. Now, this goes for education as well, general assistance, some of the things that you can see here, legal aid, caregiver services, things like that. What these people do is really make sure that our members who are in need are getting the assistance that they want, right? And this is no additional cost to our members. It's just an additional service that we at Anthem here provide. So let's get right into the products. So if you are selling currently in the state, you know that we have 2 HMO plans, and that will be no different next year. The 004 plan is offered in the counties that you can see before, but if you want to kind of think about it this way, Milwaukee area, up in Superior area, and then also Wausau is the 004. We have dropped the maximum out of pocket on this plan this year to be more in line with the 006 plan you see on the right. So $4,400 next year versus $4,300, so really in line there. The rest of these are pretty similar. The RX deductible is going to be $150 on the 006 plan versus $175. Now that's only for tier 3 through 5 drugs. Now those tier 1 and 2 drugs, you can actually bring down to a $0 copay along with the rest of our MAPD products by using our mail order system through IngenioRx. Now that's either for a 30 or 90-day supply. If your member's willing to use that, they're going to get a $0 copay on all those tier 1 and 2 drugs. One thing to note too, when you look at our drug formulary, you will see on the right side of it a $0 mark right after 30%. In this specific example, it's going to be our tier 6 drugs. What I like to call those are maintenance medications, right? So it could be things for like high blood pressure, things like that. We have about 6 categories in which fall into tier 6 drugs that are maintenance drugs. If the drug falls into that category, it's going to be a $0 copay at our preferred network. Now let's look at the extra benefits on our HMO. Now, some of these are pretty familiar if you're selling this plan currently, right? The $3,000 maximum plan benefit per year at a hearing care solutions provider. Really, really fantastic benefit there. Silver sneakers covered as always. Our over-the-counter, $65 per quarter. Now, over-the-counter benefits through us can be utilized in 3 different ways. Remember, when they sign up for this, they will get a card. They can use that card at a Walmart. They can also use that card via the catalog they will receive and call in an order or go online to place an order, all right? So they're going to get $65 per quarter with this plan, rolls over from quarter to quarter. So if they don't use that $65 quarter 1, guess what? They have that money in quarter 2. Obviously does not roll over year to year, so that's important to note. $150 allowance on vision with this plan. Now, we use the Blueview Vision Network. For you agents out there, you're going to be more familiar with this as the iMed network is what we use, right? Tons of providers within the state with our vision, $150 allowance that they can use towards eyeglasses or contacts, and they're going to get that routine eye exam at a $0 copay. Central extras, which I just went over, they're going to be allowed to pick one of those, right? Like I said, if they are not using that benefit throughout the year, they can change it at a one time per year as long as it's not used, okay? And then finally, we added some comprehensive allowance on dental. Our dental on our Medicare Advantage plans is going to go through the Liberty Dental Network. $500 comprehensive allowance, and that's going to be for your basic or major services, and then a $0 copay for your exams, cleanings, x-rays, and fluoride. Now, our dental here at Anthem is going to be, the best way to explain it, in 2 buckets, okay? So any payment towards the preventive stuff like exams and cleanings will not go towards that $500 allowance per year. Now, I do want to just kind of illustrate how this flex card can work wonders for your clients and what they need, right? So let's say your client goes to a Liberty Dental provider, they get that $500 comprehensive allowance here, and they need more work. Well, they're going to have that $500 plus an additional $500 that they can use if they select the flex card benefit, $1,000 here. Hearing, same way. Maybe they need a couple of hearing aids. They get $3,000 on us with this plan. Now it becomes $3,500 if they use that. Same thing for vision. $150 allowance right now. Nothing that they need to do to get that. Maybe they need a lot of contact lenses, or maybe they just need a couple of pair of eyeglasses. Well, now they're going to get $650, which is a lot of money towards eyeglasses, okay? So that is the power of the flex card and how it can help your member. One other thing I do want to point out this, because this isn't going to be covered on a lot of our plans, we do have the PERS program, which is a Personal Emergency Response System. A lot of people connect with what that is when you say Life Alert. We use a company called Best Buy Health. They provide our members who need it with a wearable device that can either be used as like a pendant or a wristwatch. And what that device will do is if your member is in need of service, they'll connect them with emergency systems, okay? So we covered not only the device for the member, but also the service plan for them, right? So it will be tracking them. If they fall, they can press something and they'll get emergency systems out there. If something happens, they need someone, it will get them out there. So part of it is it will be tracking where they are. Important to note that the member knows that, okay? Because we only have an hour, we're gonna skip through that. Our Advanced Directives program, this is available on our DSNP plan. This is a new availability for members. Essentially, it's a way for them to log their wishes in advance of maybe being hospitalized and not being able to communicate them, okay? So it stores them almost like in a cloud, and the nice thing about that is that all the physicians and hospitals will be able to see those directives if they are admitted. So, for instance, if a member wants to have a DMR or a DNR, do not resuscitate, on file, they can have that stored here, and if something were to happen and they were to maybe go into the hospital in a coma, it would do that. This program also will connect people with affair planning and estate planning if they so need. This can be accessed by calling our customer service team. Gonna go next into our dual SNP plans, but before I do that, it's really important to talk about dual SNP eligibility. Now, the one thing I will say as an agent, it's important to note that you are not the Medicaid office, okay? And if you're working with duals currently, you'll probably understand this. If you're not, it's important to note a lot of people that come into your office that may qualify for a dual SNP plan, meaning they have both Medicaid and Medicare, aren't going to always know what eligibility level they're at, right? So you'll see a lot of different letters on the screen: FBDE, QMB plus, QMB, all the way to SlimB and SlimB plus. These are different qualifications based on what their Medicaid level is, okay? You'll see two different contracts on this screen. What that means is that we are going to have two different plans next year. I'm going to go into both next. But the plan that a member is going to fit in is going to be based on what their eligibility is. So as you can see, the top plan, the H9525-003, is what we are going to refer to from here on in as our full dual plan, all right? So the FBDE, the QMB plus, the QMBs, those are going to be Medicaid recipients which get full Medicaid assistance, okay? This is the plan that we currently have in the market. Next year, we are going to be offering a plan for partial duals, which are the SlimB plus, the SlimB, the QDWI, and the QI members. So we will have a plan for those members. We currently do not offer a plan for them. So this is big news for us, okay? As an agent, if you suspect that someone may have Medicaid or eligibility for one of these dual SNP plans, there's two ways with Anthem that you can confirm that. The first way is if it's during the regular hours, you can contact our agent support department, and they will, once you give them the member information, they will tell you if a member is eligible for the plan, which plan they're eligible for, and their status. You can also go through our mProducer, which is our online enrollment tool. And we have a search tool on there for Medicaid, which will tell you as well what they're eligible for, what they're eligible for, and what their level is, okay? So let us do the work for you. You don't need to be going through stuff and determining what level they're at if they don't know. Use our processes. It will tell you exactly where they're at and which plan is going to work for them, okay? Now, let's start first with our Connect plan. Now, this is going to be our partial dual plan, which I just mentioned. And the reason you might notice a little difference between that and when I go into our full dual is these members, because they are partial dual members, they will have some copays, right? They will have a little bit more cost responsibility. You'll see that with the inpatient hospital, $125 day 1 through 10. The RX deductible, $480 tiers 2 through 5. Now, that tier 2 drug, which is part of the deductible, they can get around paying that by using home delivery at a $0 copay, okay? They will have a maximum out of pocket with this plan. A lot of these numbers will be a lot less than you'll see with other regular plans because it is, at the end of the day, it is a Medicaid plan, but they will have a little bit of cost sharing here, okay? Huge amount of benefit for this partial dual plan though. $2,000 comprehensive allowance per year for dental, in addition to the preventive services. We're going to give them a weight scale. We're going to give them an essential extra that they can pick from. We're going to give them silver sneakers. The healthy grocery card is not included on this plan for partial. It is included with our full dual SNP plan. 20 post-discharge meals, meaning if your member is hospitalized on this plan, when they are about to be released, we will be in contact with them and let them know they have 20 meals coming their way and determine delivery date for that. $3,000 once again on hearing. Personal emergency response system is covered here. Once again, $200 per quarter, rolls over quarter to quarter. Not a math major, but that's $800 a year that they can use in OTC benefits, right? Your vitamins, things like that. Podiatry, $0 copay, unlimited visits for that. That's going to be for routine foot care. If it goes beyond routine care, it's going to go into a specialist copay. Important to note there. 42 one-way trips, 60 miles on those one-way trips. They can use transportation to go to a Silver Sneakers location. They can use it to go to take advantage of a pharmacy, doctor, anything along those lines, okay? Or their OTC, which is important, which is, once again, Walmart. $200 allowance on vision, and that $0 copay and routine eye exam. So really, really nice benefits on this partial dual plan, which will be new for 2022. Now, here is our full dual plan. Now, huge change in a couple of ways for this plan. Number one, $0 cost share across the board for all prescription drugs. You'll see that there's a deductible listed here. Your member's never going to see that deductible, okay? The biggest change, if you're currently selling dual SNP in the market and have sold us in the past, you may know that MAP or Medicaid Assistance Purchase Plan members are not currently eligible on the dual SNP plan in Wisconsin. That will be changing. And in fact, it will be changing before AEP. So we will now recognize MAP beneficiaries as available to go into our full dual SNP plan. All right, this is a big deal for us. We know that some of our competitors were accepting those members, and now we will be as well. Huge, huge benefits on this plan, $2,500 on the dental, $50 a month grocery card included. No need to qualify for that. Now, once again, tons of different grocers involved with that plan. Silver sneakers, essential extras. They can add that flex card in here. 20 post-discharge meals, $3,000 on hearing, $250 per quarter on the OTC, 42 one-way trips on transportation, and a $425 allowance on vision. If you add that flex card to this whole deal, if your member chooses that, they are going to get some really, really great benefits. $3,000 in dental, if they want to go that way, $3,500 in hearing, or if they really need a lot of vision, eyeglass related products, they're going to have $925 they can use towards that. So just fantastic benefits on the dual SNP. Now, the nice thing about us at Anthem is we don't have a specific dual SNP network. Our dual SNP network is going to be the same as our PPO, as our HMO, right? Which makes it easier for you as the agent as well. So I am going to transition here over to our PPO products. Now, I started here with Anthem about a year ago, and one of the things that may have not always been communicated, but I think is a major, major deal in Wisconsin, is our PPO travel program will allow members to go and access care at the Mayo Clinic in Rochester in network. How our PPO travel program works is we piggyback off of different states' Blue Cross and Blue Shield Association network. So in Minnesota, Blue Cross Blue Shield of Minnesota has Mayo Clinic in network. When your member goes to Minnesota, they got Mayo in network, right? Same thing goes with Texas or Louisiana or Florida or Arizona. We all know how when people tend to get over a certain age in Wisconsin, they like to avoid the winters and go south, right? So we have a lot of options for them. Our travel program can be used up to 12 months without leaving, okay? So if your member wants to go down to Florida and stay there for 12 months consecutively, we're not going to tell them within that 12 months that, hey, you're now living in a different area, you need to select a different plan. Certain other carriers do have issues with that, right? So up to 12 months with our travel program. They don't need to call in to access our travel program. Once they go into one of these states and start using it, it gets used, okay? So there are a couple of states here, Wyoming, South Dakota, Iowa, Mississippi, and then the DC area where we just don't have a Blue Cross and Blue Shield Association network to utilize. Those are going to be the only areas in our plan, along with Alaska, where we don't have a travel benefit. So that is important to note. But a lot of the big ones that we have here, we have them in network, and your member can use them. So this is going to be one of our bigger products this year, and we currently have it. It's going to be our $0 PPO. Now, one of the things I heard a lot when I came over to Anthem is, oh, you know, you guys, I sell you guys for HMO, I sell you for DSNP, but, you know, not really for PPO. I think that this is going to be a big deal for us because this $0 PPO is expanding, and it's expanding to all the counties that we currently have Medicare Advantage in, okay? So when you're looking at some of these copays, I'm not going to go in depth, but as you can see here, we do have an inpatient hospital copay. It's only days 1 through 5 at $350. That deductible, $225. It's only tiers 3 through 5. 1 and 2, once again, you can get that down to 0 by using our mail order system. But we've added some really nice extra benefits on our PPO. We're going to give this year a $1,000 comprehensive allowance per year on the dental. We're going to allow people to select that essential extra, which is not available right now. So they can get that flex card if they want. If they need transportation, that's available to them. If they want a Fitbit for some reason, that's available to them too. Silver sneakers, available on this like all of our other plans. The hearing, same amount as you've seen before. We're going to give people $35 per quarter, an OTC. We're covering the personal emergency response system this year on our PPO, and then a $150 allowance on vision. Now, I did want to point out, because this is a condensed presentation, you may currently have some members on a $27 or a $37 PPO plan. Those plans are not going away. However, this $0 PPO will be coming into those counties. So we just don't envision those counties to be sold in the way that they have in the past, okay? Doesn't mean that they're going away. Honestly, there's really no change in what those members are going to have in terms of a benefit. We just think this $0 PPO might be a better option for them. Probably something to consider too as an agent, okay? Part B give back, what is that? Well, you're going to see what it is on the next plan because we have a very awesome new MA only plan coming into our markets next year. That plan is going to have a $50 give back on it. What that means is that $50 a month will be given to be deducted out of their social Part B premium that they're paying, okay? So if their premium is being deducted out of their Social Security check, that $50 will be credited towards that. If they pay in quarterly, that $50 will be subtracted for what they owe on a monthly basis. Now, important to note is that sometimes the government doesn't necessarily always move the fastest. You don't have to do anything to initiate this. Your member doesn't have to do anything to initiate this, but Social Security can take up to 1 to 3 months to make this effective. Doesn't mean that if during those months it's not effective, they're going to lose that money. They'll do a catch-up payment at the time it does become effective. So, for example, if they sign up in January, and then it doesn't take effect until March, that $150 will be credited starting in March, okay? So once again, nothing you need to do. All they need to do is enroll, and this becomes part of their plan. So as I mentioned, this is our MA only. It's called our service plan. We do currently have an MA only plan in the state, not a ton of enrollment on it, to be completely honest with you. And that MA only plan will be actually leaving for next year. Members will be notified of that, of course. If you do have a member who's on an MA only plan with us, we will be reaching out to you to let you know. But this is going to be a really nice story because this is a much better plan for them. Like I said, $50 Part B rebate. Now, when we talk about MA only, a lot of people sell this as a veteran plan, and it is, right? Because people that use the VA, they can get their drugs from the VA. It's credible coverage doing so. And a lot of times they get their health services done there, but it's nice to have another plan in the background that they can use if they want a second opinion or want to go to a different hospital other than VA, right? And that works for those people. In Wisconsin, we also have our senior care members, which is credible coverage provided by the state. Those people can also enroll in an MA-only plan. So this is available for them as well. Really great opportunities throughout the state. Have been getting a ton of people telling us that they think we're going to sell a lot of these. And a major reason is what you're going to see here. So in addition to giving these people the additional network, including with our travel benefit, being able to go to the Mayo Clinic if they want a second opinion, they're going to give $2,000 in dental. They're going to get that post-discharge, 14 of them here, $3,000 maximum plan benefit on hearing, $150 per quarter of OTC rolling over. We're going to give them 24 one-way trips. So if they just need something in addition to help them get to the VA, this is a plan for them, right? 24 one-way trips. $200 allowance on vision here, and then that PERS, the emergency response system, is covered. So some really great additional benefits on our MA only plan. We look at this as a leader in the market, okay? So one thing I do want to point out here is at the end of this presentation, I'm going to give you a little bit of an opportunity to put your contact information down if you have questions, but we are looking for agents to work with to promote this plan, both to veterans or senior care members. So if you have any connection to the veteran community, if you have any connection with anything like that and want to promote this, please let us know, and we'll have your local regional sales manager reach out, okay? So I've gone over the MAPD side. These are our preferred pharmacies on the MAPD side, right? So the amounts that you saw on the screen are always going to be preferred, meaning that your member's going to want to go to one of these. But we have a lot of options, right? So Meijer, which is growing in the state, is on here. CVS, Walmart, Amazon Pharmacy. If you know what PillPack was before, that's now Amazon Pharmacy. Roundy stores are on here. Costco is an option for members, and then Kroger stores. So your pick and save, saves, your Cops. We have a lot of options here, okay? So this is what our preferred pharmacies are. I believe we have over 66, oh yeah, there it is, over 66,000 pharmacies in the country, all right? So what happens once I sign a member up with Anthem? Well, I'm going to let you know what to expect in the next 30 days. Number one, 7 to 10 days after a receipt of an approved application, members going to get a welcome kit for us, right? If they're effective, they can use the plan right away. If not, they will get a member card that they can use once they are effective. That member card is going to have all the information that they need on it, including how to contact member service, how to get in touch with their pharmacy benefits, also how to contact Silver Sneakers. Now, one change for this year is Silver Sneakers will not be issuing out a Silver Sneakers card. A lot of the gyms are not utilizing that anymore. Your member just really needs to go in with their photo ID to a Silver Sneakers location, and they will look them up, see that they're part of the program, and they're good to go, okay? So they don't need a Silver Sneakers card anymore. That welcome kit will have a lot of tools, information about our tools and how to access things on it, okay? So a lot of their information will be there. Now, if they have a plan with an OTC benefit, that will arrive a little bit later. it will come with the OTC card on it. Now, like I mentioned before, that card can be used at a Walmart store or over the phone or online. It's important to note that if they go to Walmart, that it needs to be run as a gift card. If it's run as a debit or credit card, it will be declined. Now, one little handy tip I would give you is this. The OTC card welcome kit comes with a catalog of what products are available for the member to order or to select at Walmart. You can order those through our sales toolkit. It's really important that if your member is going to utilize this at Walmart, that they bring that catalog or at least look at it before going so they know which products they can select at Walmart, because if they select a non-OTC product, the card will not work, okay? Important tip to note there. Finally, this is really important. This is something that we've really tried to emphasize doing is care guide calls. So once your member enrolls, please let them know to expect a call from Anthem. It's not a scam. I know that happens a lot lately, not with us, but just in general for seniors, and it's something a lot of them have concerns about. Tell them to expect a call. It's going to be less than 20 minutes. What we're doing here is we're not trying to sell them additional products. We're not doing anything like that. We just want them to understand their benefits and how to use them. Okay, so someone will call. They'll be identified as Anthem. They'll ask them questions about, how, if they know how to look up providers or what benefits they'll have. They'll go over that, right? Any kind of question your member has. So it might even be a good thing to say, hey, expect a call from Anthem. If you have any questions in the meantime, write them down and ask that person, okay? They're also going to introduce them to our digital tool, which is called our Sydney app. Really easy to use once a member gets set up with it. They can log in the first time, put their information in, and they can actually, if they're traveling, they can it'll be via GPS, tell them what physicians are in the area if they need that. They can look at claims. They can look at all their information on there. Really great tool, Sydney Health, okay? We're doing this for a couple of reasons. Number one, we know that a member who knows how to use their plan is more likely going to stay on that plan, okay? It's really important. And those numbers have proved out. As you can see, members that actually completed that call had a 15% lower disenrollment rate last year. So please, please, please let the member know to expect a call from us and to answer it, because it's just there for us to help them. Really gonna do a very high level overview of our supplement plan. If you're not selling supplements with us right now, let your regional sales manager know, because our rates are very competitive. One of the things we'd like to do here at Anthem is not only have a competitive rate, which we know is important, but also have extremely consistent pricing, so we're not giving members huge rate increases. We're going to have some really exciting news on that for our current members coming up this next year, which look for your agent communications coming out in the next few weeks on that. But really exciting news on that being consistent. But we're very competitive on the supplement side. We have some really awesome bonus programs on the supplement, which will actually reward you for selling with us. And we have a brand new bonus program that's going to be coming out very shortly as well to give you some extra money. Our supplements include silver sneakers with them. Some supplements do not. Our supplement does not have dental and vision. So what you'll see on the bottom is Anthem Extra packages. I'm not going to go in depth in these because this is a condensed presentation, but these are ways to get your member dental or vision coverage at additional cost, as you can see here, or silver sneakers. And the reason why we have plans with silver sneakers on Anthem Extras is because Anthem Extras can be added to any supplement plan. Does not need to be an Anthem plan. So some plans out there do not have silver sneakers included with it. We're giving the option here to add silver sneakers to one of our competitors' plans, okay? So it goes anywhere from standard to premium plus. Essentially, the higher you go in price, the more comprehensive coverage you're going to get for dental or vision. and we have a premium plus dental only plan. Like I said, not going to go in depth on these, but it is an option. If you have any questions on Anthem Extras, how to sell them, what they are, how the benefits break out, let us know after this presentation. We'll get you that information. So one piece of news here that is going to be a change for some of our members is our 2021 Enhanced PDP plan will be migrating into our MediBlue RX Plus plan. Members will have information on this change by the end of the month, so before October 1st. If they have any sort of formulary disruption, they will be sent that in November, meaning that if their formulary is going to include drugs or includes drugs now that does not next year, they'll get that information as well. Really important, because if you're currently selling the enhanced plan and you look at the plus plan on the right, there's going to be a little bit of a premium shock for those members, okay? We don't envision a lot of them staying on this plan. What we don't want is members not getting the information that they're being migrated to the plus plan, and all of a sudden in January getting a bill and being like, why is my premium so much higher, okay? So one thing it will include that's different on the plus plan that will be a plus, and maybe this might be worth considering, is our plus plan for next year will have inclusion of the insulin savings program. What that means is if your members taking insulin, they can use select insulin, and they'll have a $35 copay for it for the deductible phase, the initial coverage limit phase, and the gap. So $35 through the gap with the plus. Other than that, it's like I said, it's going to be a sticker shock on the premium side. So if your member is in enhanced, I would very much recommend getting in touch with them in October and seeing if it's worth staying on for them. Okay? Agent tools. So I have 3 minutes left in my presentation, so I'm going to go very quickly through these. If you registered for the meeting today, Broker Connection is where you sign up for all our trainings. We're going to be having a lot of them throughout the year, including we do CE classes generally outside of open enrollment and preparation for that. So keep an eye on the Broker Connection site. Sales Toolkit and Custom Point. This is where you are going to get your materials, both for CMS improved customer-facing materials and also for any kind of marketing. So that's housed through the customer site, Custom Point site. You'll have access to both of those sides. MProducer. If you haven't used MProducer, very easy to use, but would definitely recommend one of the trainings that we do through Broker Connection on how to use it. Member can sign if you have a tablet right on the screen, or if you're using a computer, they can use your mouse to sign. Really easy to use, easy to track applications afterwards. Would definitely recommend MProducer if you're not using it right now. Online store, shop.anthem.com. It's our customer-facing site. You can then compare plans on there, get quotes, look up providers and drugs through that. And then Producer Toolbox is going to be where all your information is housed. So you can track your commissions there, generate new business via MProducer on there, manage applications, see your customers, pretty much anything that you need when it comes to your Anthem business is on Producer Toolbox. Now, you can also start from Producer Toolbox and get to all these sites. So it has links to all there. I would always recommend starting at Producer Toolbox and going from there. Certification. If you are not currently certified with us here at Anthem, please make sure you do so, because if you sell a plan during AEP, you will not get paid for it. GetCertified.anthem.com is the site that you need to use in order to get certified with us. We will accept either AHIP or NAHU for your training, and then you'll have some Anthem-specific training afterwards. If you are not certified, please do so now. We have less than 3 weeks before the start of AEP, and I do not want to have someone sell a plan that they are not certified to sell, because nobody I have met yet in this industry does it for free, okay? So please certify with us. If you have questions on how to get in there, having issues with it, let us know, all right? IngenioRx, this is our home delivery system. As I mentioned, when you saw $0 copays for tier 1 and 2 drugs, IngenioRx is what we use. The member can call up and initiate this. The pharmacy in IngenioRx will assist them with getting all their prescriptions set up for home delivery, including transferring prescriptions or obtaining them from a doctor. Once that's set up, the member will receive those right to their door, right? About 2 weeks for the first order to give it from the member, so let them know that. And then refills about 3 to 5 days after that. Live Health Online, doctoring 24/7 with less than a 10-minute wait for medical, psychology, psychiatry, and allergy treatments. Okay, as you notice, my voice is a little messed up, having some allergy issues right now. I could go to Live Health Online, use that on my smartphone, tablet, or computer with a webcam, and get in touch with a doctor who can help you with that. Okay, that includes psychologists. So if your member has a need for that, they're going to get 15 hours a day of someone that can help them with things like stress, anxiety, and grief. Great tool, available for our Medicare members, Advantage members only, not supplement. Okay, important note there. Sydney Health, already talked about this. If your member can use Facebook, they can use Sydney Health. As I mentioned, can help them find doctors, find care, check costs, and also has a chat feature. So if your member has a specific question, they can chat with someone and give them the answers that they need. Really great tool, Sydney Health. Look it up in the App Store on your Apple or Google or whatever phone, as long as you have a smartphone. Gets you all your member information there. Really easy to use. And finally, going to leave this up here for about a minute or so you can write this down. But once again, this is your Anthem Blue Cross and Blue Shield of Wisconsin team. We are here for you, for your comfortability with our products, processes. If you want to talk about marketing in your area, give us a call. We'd love to talk about that. Like I mentioned, we are focused here at Anthem on growth. And if you want to grow, your regional sales manager, as you see on the screen here, is the person to talk to. So anything you want to do, if you saw a plan that you like today that you really want to promote to your members, give us a call. We'll talk to you, see how we can help. All right. Beyond that, if you're having any kind of issues right now and you just don't know where to go, please let us know, because we will dedicate ourselves to getting that fixed. We understand that there's a lot of products out there and you have a lot of options as an agent. We want to make sure that when Anthem comes up and becomes a viable option for your member, which we feel it will be this coming year, that you are comfortable selling it, because we know that's a big deal. So once again, thank you very, very, very much for joining us today. We know it's really crazy this time of year. Appreciate you being on. Hope you really enjoy our products. And if you have any questions, let us know. But enjoy the rest of your Friday and have a great weekend.